For adults over 50 facing joint pain or waiting on a vital diagnostic scan, the modern NHS can feel like an endurance test. The creeping passage of time becomes the hardest part of the condition. For routine quality-of-life procedures, like the knee replacement happening in this operating theater, the average NHS wait time sits at 28 to 29 weeks. When your GP decides you need to see a specialist, they hand over a referral letter. You go home, you wait by the phone, and you assume you have to sit tight until your local hospital eventually calls your name. But treating that local hospital assignment as mandatory is a cultural habit, not a medical requirement. Relying entirely on default geography is costing thousands of patients months of lost mobility. This diagram highlights an anomaly in how we use the health service. Out of 10 referred patients, 9 stay in a static queue, accepting the local hospital their GP selects. Only 1 in 10 will actively exercise their options to go somewhere else. That single person is using the NHS e-Referral service, the specific tool granting access to bypass the default queue. By law, your GP cannot send you to just one place. They must offer a choice of at least 5 suitable hospitals. Claiming this specific legal right shifts the balance of agency toward the patient. It turns a blind referral into a strategic choice, a choice that data shows can cut your wait time by up to 3 months. The process changes how your GP appointment ends. Instead of leaving with a vague promise of a future date, your doctor logs your referral into the ERS system and hands you 2 things, a booking reference number and a password. You don't have to pick a hospital right there in the examination room. You can take those details home and pull up a crucial research tool, the My Planned Care website. This map illustrates exactly why checking that site matters. By entering your postcode, you can directly compare average wait times across different departments in your region. You might see a 28-week wait at your local teaching hospital, but notice that another trust down the road has a 12-week queue. And this data applies to a vast range of specialties. It directly shifts the timeline for high-volume lists, like the cataract surgery shown here, where wait times vary wildly from town to town. When you apply real-time data to your medical referral, the NHS stops acting like a lottery of location and becomes a navigable network. There is another crucial detail here. Those 5 legally required choices are not limited strictly to crowded NHS trusts. The ERS system must include independent, private hospitals, facilities run by groups like Spire or Nuffield, provided they hold an active NHS contract and are suitable for your procedure. If you select one of these private facilities through the e-Referral service, the treatment comes at absolutely 0 financial cost to you. Securing your chosen slot is straightforward. You can log into the NHS Referrals website with your code, manage it directly through the NHS app, or call their dedicated 0345 helpline to have an advisor book it for you. If you need a diagnostic scan, like an MRI in a scanner similar to this one, rather than surgery, you can also use the system to select community diagnostic centers. These are dedicated local clinics that often move much faster than main hospital radiology departments. The ERS system effectively bridges the gap between public funding and private sector speed, democratizing access to faster care for anyone willing to log on. Of course, you might be watching this already stuck on a long, static waiting list, wondering what your options are now. Look at this timeline. Under NHS rules, if non-urgent treatment delays beyond a strict 18-week threshold, a safety net engages, automatically reactivating the right to choose. At week 18, contact your GP or hospital to request a formal transfer to a faster provider. As long as you understand the administrative rules protecting you, you are never permanently trapped in a failing queue. Securing faster treatment does require a physical reality check. You have to be willing to travel slightly further from your local high street. But weighing a 30-minute longer drive against the prospect of regaining your mobility or your eyesight months earlier makes it an incredibly profitable trade-off. Before your next GP visit, check the My Planned Care website. Look at the data so you can walk into the consultation room already knowing which wait lists are the shortest. For further targeted advice on navigating specific medical needs, make sure to explore our dedicated procedural guides. The NHS is a vital institution, but modern patients cannot afford to be passive. By actively navigating the geography and the data, you can secure the fast, high-quality care you are legally entitled to.